So we're going to keep moving along in the program, and I'd like to invite the next segment, the workshop or presentation about demystifying ACS. That is my colleague Henry Goldschmidt will be moderating that segment. So it is Kristina, Daley, Nigel, Nathaniel, and Yolanda Howard from ACS on this next segment. Thank you.
So, hi, good morning, everyone. I'm Henry Goldschmidt, the Director of Education Programs at the Interfaith Center. I'm delighted to be here and help to moderate this next panel. And while our distinguished speakers are settling in, I'll just say very, very briefly, a word or two why I think this is such an important conversation to continue. I think in many ways, our panelists right now are going to continue developing some of the issues and themes that the Commissioner raised in his presentation, but really go into a lot more sort of nuts and bolts details about how ACS works in all the different, not all, but many of the different aspects of its work. And I just think this is extraordinarily important because, the ACS system plays such an important role in the lives of so many New York families and children. But as with so many things, the media only covers it and shares news about ACS in the rare and tragic cases when things can go wrong. So I think most New Yorkers, including faith leaders, have a really limited understanding of how the system works on a day-to-day level to serve children and families. So that's going to be the theme of this panel, and then actually the next panel after this will continue to go into even more detail about how ACS forms partnerships with different diverse communities around the city. So for now, I'm not going to read everyone's bios because you have them in the packet for the conference, but we have Nigel Nathaniel, the Director of ACS Office of Community Partnerships, Kristina Daley, the Director of the Family Permanency Division, and Yolanda Howard, Community Coordinator for the Office of Parent Support and Recruitment. And Sarah, how are we on time? We're a little bit late and we want to kind of get a little back on track, so I'm going to ask our panelists to speak maybe for 8 or 10 minutes. Is that about right? And I'll warn you that I have little time cards that I will not be afraid to use. And then we'll make sure to have enough time for questions and conversations after this panel and then sort of stick to our schedule. Thank you very much, and it's up to you guys who makes sense to go first.
Hi, good morning. Good morning, everyone. Good morning, everyone.
Good morning.
I'm Nigel Nathaniel, sometimes known as Nigel Hawthorne. I'm the Director of Office of Community Partnership at New York City Administration for Children's Services. And one of the things that we have done over a number of years is come out to various settings, community settings, religious settings, and speak about ACS. And a few years ago we coined the name Demystifying ACS, where in maybe less than an hour, and today it's less than 59 minutes, attempt to demystify ACS. Because there's a perception out there about the Administration for Children's Services, and part of my office responsibility is to bring a reality check to what we do at the Administration for Children's Services. In the opening remarks, Rabbi Wolf Weiser, I think he gave a great overview, a quick overview of his interactions with child protection and some of the work that he has done in the Jewish community, working with our Child Protective Office. And I think throughout the city, this is what we attempt to do. Go out and speak to community folks, speak to religious folks about about the Administration for Children's Services and bring that understanding that we are there to support, stabilize, and serve families. And that's an important point, because I think that the Commissioner mentioned that a number, maybe 30 years ago, there were about 50,000 children in foster care, right? 30 years ago, 50,000 children in foster care. At this point in time, we have less than, as the Commissioner said, 12,000 children in foster care. And Kristina and Yolanda would speak more about foster care as we move forward. However, but that's an important piece, that we at the Administration for Children's Services, working in the community, informing the community, and as Diane mentioned earlier, Diane Mack mentioned earlier, partnering with the community to understand how can we better serve the community, serve the children and families in the community, and provide what we would term as preventive services. Presently, we are contracted with over 60 organizations throughout New York City and provide preventive services to close to 30,000 children. Again, if we go back in time, within the last 5 years, we are serving more families in preventive services, 30,000 children, than we are serving in foster care. And for us, that's a tremendous accomplishment, with that understanding that our responsibility, our role is to establish ways where we can stabilize families, support families, so these families wouldn't have to enter our foster care system. So preventive services is a continuum of services for children from birth, adolescence, and young adulthood. The goals of preventive services is to prevent child abuse and neglect, reduce the need for foster care placements, promote children's health, safety, stability, and well-being, and strengthen and support families. The preventive services, they achieve these goals by assisting with concrete needs, crisis intervention, parent education, advocacy, referral service, and coordination. One of the models that we have engaged in throughout the different divisions at ACS, because there are over 6,000 employees at ACS, and then maybe more than 10,000 employees with our foster care agencies, our preventive agencies, our early care education agencies. So it's I think the Commissioner mentioned that the budget is close to $3 billion. That's a lot of money, right? I myself, I didn't realize it was that huge. However, there are a number of employees, 6,000 with ACS, and I would dare say about 20,000 employees otherwise focusing on stabilizing and the safety and protecting children in New York City. One of the things that we have done with the preventive services and with family permanency and child protection is having family team conferences. Again, Diane Mack took part of our presentation and alluded to that earlier on, where we at every important step within the continuum for children and families in the child welfare system, we at ACS, we pause, because sometimes we find ourselves going too quickly and making decisions a bit hastily for our children and families. So we pause and we have a conference. It's a child safety conference in some instances. It's an elevated risk conference in some instances. However, the important piece, it's a family team conference where we bring the family and have a discussion with them. The family is entitled to bring anyone who can support them and provide information to the Administration for Children's Services or our contracted agencies about how can we keep these children safe, keep the children safe in the home, in the community, and when necessary, we will have to keep the children safe by placing them in foster care. However, but the whole concept about having a family team conference is an important step. Again, when we at ACS pause and we listen, because we have agreed, I think most of us at ACS have agreed that the families are the experts in their lives. And we keep on messaging that the families are the experts in their lives. We have to listen to what they are saying. So they have to be involved in the decision making. And again, a point I wanted to emphasize that the families are encouraged and they are very encouraged that they bring support people to these conferences. It could be their rabbis, their imams, their priests, their pastors. It could be a family member. So if you hear one of the members of your congregation saying that they're going to a family team conference with ACS, you can remind them or inform them that they are entitled to bring members of the community, be it religious, be it family members, to these family team conferences. For preventive services, there are different types of preventive services, and these can be accessed for the majority of families referred, the majority of those 30,000 families that are referred for preventive services are referred by our Division of Child Protection. Are referred by our Division of Child Protection, and families themselves can self-refer to preventive services. In addition, shifting gears to another division within ACS, the Division of Child Protection, that's the division that does the investigation that was alluded to earlier on by Rabbi Weiser. That's the division that investigates allegations of abuse, neglect, and maltreatment. And we handed out a blue card. Everyone should have a copy of this here. And it speaks to what happens when I report a suspected case of child abuse or neglect. And this kind of gives you a flow chart of a child protective investigation. And again, it's important to note that we handle over 60,000 investigations every year. And there's a perception out there that once ACS gets involved in a family's life, that a removal occurs. And that's the furthest from the truth, that I think 60,000 investigations, it somehow translates to maybe we get in contact with about 80,000 to 90,000 children. And out of those 90,000 children, I think last year we removed less than 6,000 children we removed from their homes and placed in foster care, less than 6,000 children. So I bring this up to highlight that when we do an investigation, once we get involved with families, our main focus is keeping children safe, and our main focus is keeping children safe in their homes, keeping children safe in the community, and in 6,000 instances last year, we had to put children into foster care. I would turn over to Yolanda, where she would speak about foster care, and then you can ask questions about the Division of Child Protection and the Division for Family Support, Preventive Services, and later on, Dale, Joseph, Raul, Rubio, and Flora would speak about the community partnerships, which I'm the director of that office, and plays a very important piece in connecting with the community. So, Yolanda.
So, good morning. I'm Kristina Daley, and
sorry, Kristina.
That's okay. I'm going to talk a little bit about the types of placements before we get into the certification process, how we go about recruiting foster family homes. Placement occurs only if or only when preventive services cannot. Speaking the mic, no. Okay. So, what Nigel talked about in terms of DCP, or Division of Child Protection Services, doing an investigation. The first goal is always to keep the child within its family setting. It's the family that they dwell with. If there is an imminent risk where preventive services would not be sufficient to keep a child or their siblings safe, then the need for placement becomes what we look for. In terms of placement, the first type of placement New York City Administration for Children's Services wants to think in terms of is least restrictive, meaning a family setting. Commissioner Richter did talk about custodial care, and he talked about children going to a relative. In New York City, most of those relatives are paternal or maternal grandparents. They go directly into care with them under guardianship or custody. That prevents them also from coming into foster care. But if foster care is necessary, the principle is least restrictive placement, a family setting. And we still will first look to placing a youth and or his siblings with a family member. And that is called kinship care. Within kinship care, the child is placed with someone that they are related to by blood, marriage, or clan, if you will, a family friend, someone that they have close ties to. Those individuals fall under kinship care just by virtue of knowing the child. That is least restrictive and the least traumatic. I mean, trauma is going to happen with placements in general, but if a child is placed with someone that they know, we believe that's less traumatic for the youth and allows for continuity of stability within the family. If kinship individuals are not able to be identified within the time placement is needed, then we go to the next level of care, which falls into foster family, which is a non-kinship placement where the children or youth don't know the family that's been identified to care for them until they're able to be returned home. Family foster care is assessed, the child is assessed to need just basic care from parents or adults that are able to provide all of their needs at one time in a home. The next level of care would be therapeutic. Therapeutic family foster care is where a child has been assessed to have some needs, be it emotional or physical, that a regular family foster home are unable to meet without additional support and services supplied to them while the child is in their home. Those types of services usually include additional visits to the home by maybe a therapist. If there's a physical need, if the child is considered to be medically fragile, a nurse may visit the home. And so those are additional supports that come with a child that is placed in a treatment family foster care setting. The next level of care is one that the Administration for Children's Services really works to shy away from as much as possible, and that is a group home. There are two different types of group homes. There are group homes and group residences, and the differences between the two is really just regarding the number of kids in one group setting. So once we get above the number, I think it's 6 or 8, then we get into residential style living. The reason why the Administration of Children's Services and our provider agencies really push to work to put children in family settings such as kinship care or regular non-kinship foster homes or treatment family care is because with group home placements, there's 24-hour supervision. Like our foster homes, they have to have 24-hour supervision, but the individuals that provide the supervision changes on an hourly basis. So if a shift is 8 hours, you know, there's always a different pseudo-parent that is providing care for that youth or youth within the group home or group residence. The next level of care would be residential treatment facilities, which is when a youth is identified with a high level of need that a traditional family foster home, be it kinship or non-kinship, or a treatment family foster home will not be able to meet, at least in the immediate instant need of placement. So youth is placed within a residential treatment facility, preferably short term, to be stabilized and then step down into either a kinship placement, a non-kinship placement, or a therapeutic placement. Again, family settings are the preferable settings for youth in need of out-of-home care. If the needs of the youth present as needing a facility style, it's supposed to be, as I said earlier, it's supposed to be temporary. At the most 6 months for treatment, family foster care, and group home residence, as well as residential treatment facilities. There are also some interim settings. So if a child is referred for placement by DCP, and there is not a clear understanding of what that child's needs are from the child or from the family, there are crisis programs, usually up to 30 days, where a child can be placed. It's residential style, but then assessed to ensure that when a placement is identified, it's the best possible setting for them. And again, the preference is a family style setting, starting off with kinship and leading up to treatment family foster care. So those are the different levels of foster care, and Yolanda is going to talk about the process of becoming a foster parent.
Thank you.
Speak low so I know this. Hello, my name is Yolanda Howard-Jones, and I'm a community coordinator with the Parent Support and Recruitment Unit at ACS. The mission of ACS is to protect, promote the safety and well-being of New York City's children, young people, families, and communities by providing excellent child welfare, juvenile justice, and early care and education services. One of the needs of ACS is to find safe, loving, caring, and affirming homes for our children that are in care. To address the need, ACS began a new campaign called Be the Reason. Some of you may have seen it. The Be the Reason campaign began in May of this year to reach out to the diverse audience in New York City. Be the Reason campaign ads were placed in various locations, such as media, transportation. Some of you may have seen it on the trains or on the buses. This was used to increase awareness. The campaign is targeted to prospective parents to provide the children in our care a safe, supporting, and loving home. It is also used to increase awareness to prospective parents that they can qualify to be parents to our children. So what are some of the requirements in terms of becoming a foster parent? There are a number of steps in order to become a prospective parent to one of our children that are in care. There is an orientation process in which prospective parents will have to attend. At the orientation, you will receive an in-depth explanation of the certification process and of your future role as a parent to one of our children in care. You also need to complete an application. The application will be provided at the orientation. And this is used as a means to see if you qualify, if you have some of the basic requirements of becoming a parent to one of our children. All applicants and any household member 18 years of age or older must complete what we called an SCR form. It stands for State Central Registry of Child Abuse and Maltreatment. This form is necessary to determine whether the applicant or any household member is the subject of an indicated child abuse maltreatment report. In addition, if the applicant or any member in their home 18 years or older lived in another state within the 5 years preceding the application, information from each state's child welfare agency will need to be obtained. We also have to do a criminal history record check in which all prospective foster or adoptive parents and household members will need to get fingerprinted. All members of the household must have a medical form completed as well. We also have to have a home study completed. A home study is a written biography of your family. It describes your family dynamics, how open you are to change, how stable your family is, your family history, exploration of marriage, your relationship history, parenting, your expectations of the needs of the children that are going to possibly be placed in your home. All members of the household are part of the home study process. It is very in-depth, and we just ask that everyone be forthcoming. Also, we ask that prospective parents submit references. These are people who are not related to you. These references provide an overall summation of the reference's view of how well the applicant's character and ability to care for children. A home study also looks at your experience with issues of child abuse and neglect, your roles and responsibilities of becoming a foster or adoptive parent, and your willingness to work in partnership with the birth parents, which is very important to work with the birth parents. We also ask that all prospective parents are able to sustain themselves financially by having their own source of income. In addition, all prospective foster parents must complete 30 hours of MAP training. That stands for Model Approach to Partnerships in Parenting. It looks at your own strengths and needs, stages of development, how well you can handle a child's behavior. Certified parents must complete 12 to 15 hours of training that is geared to the specific child or children in their home.
Sorry.
It's okay. And in terms of supports, once you become a foster parent, a parent to one of our children in care, support is very important as well. So the first line of support for our parents of course, should be the caseworker and the supervisor. They should be, you should be able to call them at any time to get information on the child that's placed in your home, get support from them, vent to them, whatever the case may be. Nigel spoke about family team conferences. That's another source of support. We have a Bridges to Health, which is a waiver program that provides supportive wraparounds and aftercare services to children, youth, and adolescents, their birth, foster, and adoptive parents, and siblings in their communities. There's, of course, foster parent support groups. This is an excellent source of support for foster parents. The groups allow them to discuss their issues and concerns, and it also provides a sense of networking for foster parents. There's also foster parent advocates. Foster parent advocates serve as a source of support for foster parents by helping parents navigate the foster care system so that they can advocate for not only themselves, but for the children that are placed in their care. And of course, we have the community partnership. There are 11 CPPs, community partnership program, within the 5 boroughs. The CPPs offer support to parents by connecting them to resources within their community. I have information on the table regarding how you can also, if you're interested in becoming a foster parent or would like to, if you know someone who's interested or just want to know more about it, I have information. It's Be the Reason. It talks a little bit about our campaign. The possibilities are endless once you decide, or if you can help someone to decide, to become a foster parent. There are a number of children that are in care that are in need of people who are willing to provide the best care to them. Also, I am the co-lead for the faith-based partnership at ACS. So if any of your churches or mosques are having any events and you were willing to invite an ACS representative, I'm more than willing to come out and talk more about becoming a parent to one of our children that are in care. Thank you for your time.
Thank you.
We should probably have a good questions.
Yeah, no, we definitely want to, if people could, if you have questions, maybe approach the mic in the center. But then also, as people are doing that, there's one thing that I wanted to ask to our panelists. Nigel and Kristina especially, I think, did a fantastic job of kind of walking us through the steps of how the different ways that ACS works to support families and children through preventive services, and then in some cases through placement. But I wonder if you could step back, before that, and say a little about how families and children initially kind of come on your radar. I was really interested, Nigel, that you said that in some cases families, parents will refer themselves for supportive services, which I think is fantastic if people will step up and do that. But then in other cases, how do people come into the system initially? Right,
so I refer you back to this blue sheet here, and that for ACS to investigate suspected child abuse or neglect, people in New York City would have to call the State Central Registry, and the number again is listed on the top of the sheet there. And that's the only way that New York City Children's Services can begin an investigation. It has to be registered with the State Central Registry. And this State Central Registry is in Albany. It's a central number in Albany. Once they get the information, they determine if the case should be received and referred. So after they accept the case, that there's some, from what they're hearing on the phone, from what the person is communicating, that there may be evidence of abuse or neglect, they accept the case, and then they send it to our child protective offices. In each borough, there's a child protective office. In Brooklyn, in Brooklyn, I believe there are at least 6 or 7 different borough offices. In the Bronx, 3 borough offices. So there are borough offices that staff from our Division of Child Protection. They're there, and they receive this information, and based on the location, we have the offices located in the community or close to the community. So based on the location, that case would go to that specific office, and an investigation gets started. So we kind of divide the reporters into mandated reporters, or anyone from the public can also call this number. Mandated reporters are school teachers, social workers.
Most of you in the faith community
are faith also leaders considered mandated reporters by definition?
If you come in contact or have a responsibility in terms of support or guidance you could fall under the category of mandated reporter. And those are the individuals that are responsible for making phone calls. They are mandated to make that phone call if there is a suspicion of neglect or abuse, and can be held accountable should a child be discovered to have been a subject of neglect or abuse, and it's found out, say, in my capacity as a social worker, that I was aware of it and did not make a report. That could have negative consequences on myself as a social worker. It could have negative consequences on faith leaders if they're aware of it and do nothing to intervene. So 311 is there, or the state central registry is there to make that phone call and let them determine whether or not what you're reporting warrants an investigation. And there is a number out there, and DCP is not with us. They know the number of calls that are made, and the actual number of investigations that occur as a result of that call.
Other questions? Please. And if you could all just identify yourselves briefly and answer your question.
My name is Imam Dr. Mohammed, I look members of the Islamic community. I want to thank you. This was very informative for me. I'm very glad that the community has put this conference together. I'm pretty clear on the roles of Ms. Howard and Ms. Daley. I have a question for Mr. Nathaniel. I'm not sure I fully understand the preventive role. I didn't hear maybe 2 or 3 examples of how you actually do the prevention. I understood about the goals and objectives and some of the other things that you said, but could you give me maybe 3 examples? As the Imam, I'm interested in the kinds of things that we can do or the resources out there for the prevention.
So I think I mentioned before, again, there are 60 agencies across the city that provide these preventive services, and when the family comes in, the family comes into the office, they make home visits to the families, they do an assessment, they do a psychosocial and some.
What is the service that's preventive? That's what I'm really interested in. You identify. What makes it preventive?
Well, because there are a number of, we come into contact with families that the children might be maltreated or suspected of maltreatment and neglect. And our focus is that what interventions that can we give to these families in our mind is that preventing them from coming into foster care. We determine a level of risk and a level of safety. Risk is in the future. What risk factors that this family has that may, in our foreseeable future, have them go into foster care. Then safety is immediate. An example of safety is that you go to a home, a child protective worker goes to a home, and a 5-year-old and a 6-year-old is there alone. We ask, where are your parents? The parents are not there. That's a safety issue. Risk is a parent who may be using a substance, may be using substances, marijuana, crack cocaine, right? And we try to stabilize that family. That wouldn't be considered a safety issue unless that parent who is using marijuana or crack cocaine is the same parent leaving the 5-year-old child at home. Then that becomes a safety issue. So the whole idea is that we come into contact with around 80,000 children every year, and we have to make a determination that, okay, some of these children, these families, we refer to preventive services, but in our mindset is that we don't want these children to come into foster care. We want to stabilize these families. And the stabilization is done from a child welfare perspective. However, it's no secret that most of the interventions that we do at ACS are done in poor Black and Latino communities. And I think the connection there, so we have this cadre of services that we call preventive services, and our message, part of our message to everyone here is that we need the faith-based community to support us, because again, we acknowledge at ACS we cannot do this job alone. So we as a government agency, we provide interventions. However, we would need the faith-based community to help us support these families because, again, there are a number of poor Black, Latino, especially, and other families that need these interventions. We need the support from the faith-based community in stabilizing these families. So,
just to further address the entire concept of preventive services, the services themselves based upon the needs of the family. So they will be family-centered and child-centered. And one of the ways entities such as a faith-based community could assist with providing preventive services is once they are identified, what does that place of worship have to offer to assist with providing those services. So a youth can, the example of a 4 and a 5-year-old being left at home, perhaps they were not left at home because the parent uses drugs or is engaged in illicit behavior. They could actually be at work and have no one to assist with just babysitting, especially if they're working non-traditional hours. So the way the faith-based community could assist in that, if that parent really has no one in their spectrum other than the church, an individual like grandma of the church or an elder in the church who loves children could assist in that regard, either come into the home and provide appropriate and loving supervision for children while those parents go off to work. So that's an example of the type of prevention services that can be put in place to keep that child in its family setting.
Next question.
Hi, good morning. My name is Susie Sanford. I'm the Assistant Executive Director for Programs at Edwin Gould. We're also a foster care agency. I wanted to expand a little more, go deeper into the earlier comments related to faith-based child welfare. So I know there are, for example, we have one foster care agency that's specific to the Orthodox Jewish community. And I wondered whether there is some kind of opportunity for other communities to develop mechanisms so that the children are treated in accordance with their religious lives, similar to that community. In addition to that, I thought again on the question of the Multi-Ethnic Placement Act, which is the law that establishes that you cannot deny or delay placement based on race, religion, ethnicity, or culture, how that coincides with the ideology ACS is emerging with related to culturally relevant practice, and if you could speak to those two areas.
In the next presentation, Dale, Raul, and Flora would expand more about the community partnerships. However, what we can do is within our ability, we can have conversations. Yolanda stated that we would come out to the various churches in the community, the synagogues, the mosque, and have discussions with the congregation about how they can play a part in supporting young adults, children of different ethnicities in the different communities. And I guess the whole message is about building relationships, building trust, and partnering. Presently, as I think Reverends Mason and Wyatt mentioned, we have a faith-based partnership. Yolanda also mentioned that, which is presently we have 11 churches and we are expanding. However, I guess part of the conversation, part of the ongoing conversation we will have with Sarah is how can we use our somewhat limited resources at ACS to ensure that there's consistent communication across the board with all the religious denominations.
I mean, there have been attempts, especially to my knowledge and personal experience within the Muslim community, to develop a program that provides preventive and foster care services to youth of the Muslim faith that may need foster care services, be it preventive or placement. That has not come to fruition, and to our knowledge, there's nothing on the immediate radar to contract with an agency such as OHEL, a religious-based agency, to provide those services. However, it's still our goal and our responsibility that when we are servicing a family of whatever religious faith or belief, we are responsible to work with them and get an understanding of that child's needs if we are unable to identify a family within their religious community to provide services. In respect to MIPA, Multi-Ethnic Placement Act, the law was put in place to really prevent youth from folks from us, actually, people that do the work, to pick and choose who has a right to the best possible home out there, who has a right to a family. And so they really work to say it's not to deny a youth's race or religion, but to really make sure that they're given the best opportunity to be placed in a family setting. And one of the questions that was brought up, and I think it was by you, I'm not sure if it was you, Henry, in terms of, well, you don't make a match. Sure, that's our first goal, is to really try to make a match in terms of the age of the youth, in terms of the needs of the youth. That's where we start. MIPA prevents us from calling a family and saying, well, I have a black child who is black with blue eyes and coming from the Navajo Nation. We are unable to say those things directly to a foster family. However, as Yolanda said, through the home study, we assess you. We assess anyone that is interested in becoming a foster parent. And like I like to call it, from the womb to the tomb. So we want to know everything about you from the time of birth to where you are now. And every aspect of you is going to be discussed, from your race to your education, how you were raised, your beliefs in terms of child development, in terms of raising a child. And if we're putting a phone call to a foster parent because we are in need of a home for a child, foster parents have every right to make sure that the child that we're calling for, they will able to meet their needs. So questions regarding the race of the child come from the foster parents. So while we can't, MIPA prevents us from saying exactly the racial background that we use, the foster parent has a right to ask that question. And because they are trained, and we discussed with foster parents through 30 hours of MAP, the importance of knowing your family and your community, which will be the best fit for a child in your home. So our goal is to always first place children into safety. Along with MIPA is ICWA, Indian Child Welfare Act. And ICWA really tells foster care agencies throughout the country that if there is a child of Indian descent, our first responsibility is to reach out to the Native American community. And the Native American community, will determine if that youth should be enveloped into their community. They'll identify a resource within their community. We must, as a right of the child, a right of Native American community, we must do that first. And if we're unable to do that, then we will make placement into the general foster family population. Did that answer your question somewhat?
It's just a culturally relevant practice, because that's, I imagine, it's still part of child success.
Yes.
And so how does that connect?
So when Commissioner Richter was talking about the upcoming matching process, that we'll be able to kind of Google it and have open discussions about the youth through what we know about that child or children coming into care, what we can report in a concise manner, so that when OPA refers a child to an agency, they're already doing it with a certain number of families in mind. And those families that come to mind or matched through a computer-based system has all those categories as close as possible, okay, regarding cultural competence. When we're conducting a home study, we're asking what your culture is, right? So we even go so far as to say, if you identify as Black, do you identify as Black, Hispanic, or non-Hispanic? That's part of our race, but then it also lends itself to some cultural identification that will help in the matching process. At the end of the day, it's very, very difficult to match precisely. Because if I have a family that is of Hispanic descent and speaks Spanish, and I have a youth, and what I know about that youth says that he or she is Hispanic and speaks Spanish, but they're Dominican and the foster family is Puerto Rican, there's still going to be some cultural gaps there. The linkage may be the language, and even that will have nuances. I say that just to say it's difficult to make a perfect match, but we work to do our best to make the best possible match in order to meet the needs of the youth that are coming.
Can I also ask just a really quick follow-up on this? I was really struck, Yolanda, in your presentation, you said that families get as many as 12 or 15 hours of education about a specific child before they receive a placement. Can that, does that education include some kind of religious and cultural diversity component to sort of give a foster family a better understanding of the background of the child that they're going to be caring for?
I'm going to leave that question to Kristina, because...
Okay, so with the 15 hours of training, it lends itself, the additional hours of training lends itself more to our specialized foster supported home programs. If we're talking about a new family, so traditionally our families that are coming aboard and being certified to work with youth that we've not identified any special needs for, they're required to participate in 30 hours of the MAP program, Model Approach to Partnership and Parenting. If a foster family or prospective family comes to a provider agency and says, I'm interested in working with children with various needs, they will get additional training. So if they're interested in becoming a treatment family foster care where a child will be placed with them that has some type of emotional need or developmental disability, that type of need, they will get an additional 27 hours of training to address issues of trauma, to address issues of emotional stress, to help them understand how to work with the child. The cultural competence piece comes into play for both regular and therapeutic throughout the sessions of the training. For instance, there's one session where we really try to get the foster families to think outside of who they are. And so if I'm a family, and I'll get a little, silly, right? If I'm a family of squares, right, and I have a triangle, right, and this is literally how we try to put them through the exercise. So it's a family of squares, but I'm placing a child in your home, that child's a triangle. So the triangle could represent race, it could represent culture, it could represent religion. It could represent sexual identity, right? So now that child comes into place, our first goal is always to certify individuals that are affirming, regardless of the shape of the child, right? So they're going to welcome that child. And what they do in order to ensure cultural competence regarding religion, regarding sexual orientation, is if I am a Black parent and I take in a child who is from Croatia, right, and who may be Muslim, now I need to be able to identify the religious communities within my community that will meet their religious needs, and be open enough to learn as much as I can, but also to take them to their place of worship. So that's just a simple example of how we work with foster families to be cultural culturally competent.
Thank you, and I've been informed that we're really running short on time. So for the remaining questioners, I just want to ask you quickly, if you have a question that's really specifically to the issues that our panelists have raised, let's hear that now. If not, we have another panel immediately after this focusing on ACS community partnerships. So certainly our conversation with ACS is not ending yet, but this panel is going to end in like 2 minutes.
We'll also be here, right?
So, but if you have something relatively brief that's specifically on an issue that these folks have raised.
Hi, good morning. We're going to be relatively brief. I am from ACS, the Bronx Division of Child Protection, and I just wanted to support my colleagues because when it came to the Division of Child Protection, we're here and we just kind of wanted to inform you that we are well aware of the different faiths and different cultures within the Bronx, and we definitely support you guys. And there was a question on this side of the room about parents and clients being known to ACS, and I just wanted to add on that clients can walk into the office. It's not only through the State Central Registry, because I know in some cultures, some families may not get out as much, so may not be known as much to the community. But if they feel that they have a need, they can walk into any of the borough offices and request help. I have a lot more to say, but we'll step back. But I just wanted you to know if you have any questions regarding the Division of Child Protection, because this is our day-to-day work. This is something we do every day, and it's actually our staff that goes into the homes and investigate the allegations. Feel free to approach us. Thank you.
Hello everyone, my name is Pamela Wallin. I also work for Bronx Division of Child Protection with ACS. I work closely with the adolescents, with the teens, and we heavily rely on community-based agencies and preventive agencies. We try our best not to further criminalize, vilify, and further traumatize our teenagers. You know, dealing with our teenagers are very complex. Parents come to our office frustrated and overwhelmed with their teenage children, begging and pleading for help, sometimes frustrated and wanting placement, and we try to implement therapeutic interventions to help the parents, to help the teens, to prevent the teens from going back into detention a lot of times. And if anyone want to further talk to me, you can speak to me in the back, okay? I know we're short for time, okay? Thank you.
Hello there. My name is Mariam Plaja. I'm actually a psychotherapist, and in my past lives, I've worked in ACS programs. I've been a preventive worker for 3 years. I was a foster boarding home supervisor for a while, and now I'm coming on the faith-based side of it and trying to make connections and try to provide services and for Muslim kids in foster care and preventive things, and we're trying to figure out how to kind of get connected. And I think some of those questions will come in the next panel, but there are certain things where most families that I worked with when I was working out in Queens, at any given time over 3 years, 50% of my caseload was either South Asian or Muslim. And I would say 99% of those families did not share with their community ACS involvement. So how can a community be supportive of these families if the families aren't sharing it with the community that this is an issue? So I was wondering if there's some way to kind of, and then, there's also confidentiality issues and everything as well. So how can we kind of create a partnership to provide this kind of service, or maybe be somewhere like resource people maybe to ACS? So if there is a Muslim family that's coming in and they're having this case conference, and it might be helpful to have like someone who has that spiritual background that can offer support to be present or something. So is there room for that?
It's a gigantic question that I'll ask you to answer in like 2 minutes, and then my promise will continue these themes in the next panel.
So if it's okay with you, I would leave that question to be answered by Dale, Raul, and Flora. If that's fine with you. That's the next panel.
Okay. Can I ask one short question as well? Okay. So in terms of, we were talking about recruiting foster parents, so this is something else that we're kind of looking into doing through the agency Smile for Charity that I'm working with right now. And I know that ACS subcontracts services out to other agencies. So who does the recruiting of potential foster parents? Is it the subcontract agencies or ACS?
Both.
Both? Okay.
Yeah,
So if we're doing this, if we're trying to kind of collect a pool of parents that are potentially interested in becoming foster parents, we approach you guys then, right?
You could. So I mean, there are actually two avenues, and Nigel did mention the next panel, which will be able to fully address your first question and also address your second, because through the community partnerships, right now they're only 11, right? And they're throughout the 5 boroughs. And so I'm sure within the community that you come from, there's a CPI or community partnership that is close to you that you could begin to participate in. Your group can participate in, and then there's a subset of a group that focuses on recruitment and retention of foster families, and they are linked and work directly with the provider agencies. The Administration for Children's Services, the campaign to recruit foster families, as Yolanda stated, is Be the Reason, and it's large and in scope purposefully so that it could reach all segments of our society within the confines of New York City. And then that trickles down through our contract to the provider agencies. So there are about 32 provider agencies that actively recruit. They're going to be piggybacking off of the Be the Reason campaign, as well as pushing forth their mission. Some of our provider agencies provide services specifically for older youth, some specifically for adoption, and then most for general care for children of all ages and religious backgrounds.
Thank you, everyone. I'm sorry we have to end this part of the conversation here, but absolutely to be continued in a moment. Thank you, all 3 of you.